that is going to make an impact, and your sphere of influence in that space will continue to grow and expand. And you'll find different ways to maybe collaborate and make connections. Maybe that friend that had a different thing that they were excited about, maybe over time, that will actually end up being something that kind of blends together, and or you end up being able to do something together. So,
No, that's cool. You know, and I love what you said about it meets people where they're at. 'Cause that's the same thing we're doing in public health. That's the whole goal of meeting people where they're at. When it comes to their non-medical needs or even their medical needs, where can we meet community at?
yeah.
Um, Another thing I want to point out, because having a civic engagement conversation at a public health conference isn't really, I mean, I'm sure they're at conferences, but there are people that are going to be in medical spaces, public health spaces, that are going to be at this conference, that were like me or like somebody and not really seeing the connection to health. And I don't want to give the panel away. like, like, I don't want to give it away. You just got to be there November 14th.
Yeah. Come see us.
But in some of our pre-panel conversations, like, it's very clear that little parts of, you know, civic engagement or, you know, being engaged in your community play huge roles in the health of the public.
Yeah.
And one of those, Victoria, is, I know we've talked about transportation, which is a huge one.
Yeah.
Can you talk a little bit about, you know, your role with transportation, and why do you feel like it is so important to the overall health of the community, but also a civic engagement piece?
So I work in public transportation here in Des Moines, and I would tell you that transportation is the undercurrent and most important thing outside of civic engagement. Because some people can't be civically engaged if they don't have public transportation.
Talk about it.
So, like, the root support system for everything that we do is having good transportation. And that looks like a million different things, whether that is public transportation like I work in, whether that is having access to a vehicle, having money for gas, whatever that looks like. Transportation is just core to folks. So I personally, the work I do is in long distance commuters, so expanding opportunities. So as you talk about health, you know, maybe there's some really good job that's in Newton or that is in Pella, and you wouldn't normally in Des Moines consider one of those two locations if you don't have a car. And so you have this great opportunity for a job which would get you access to health care. That's the number one way most of us get health care is through work. And so that's not something you would consider. So you would stay at a job maybe here in the metro that doesn't offer health care because you don't know that's a possibility. So what I do is I help people set up opportunities to be able to get those jobs at those longer distances in affordable manners that will give them then access to health care, a living wage, all of those sort of things. And of course, all of those are important health, like access to health indicators. The amount of money that you have access to, the access to health care, the mental health services that you're able to receive, the food you can provide your family, right? Like the list goes on and on. And so transportation just winds up being key to that. I encourage everybody also to ride the physical aspect of public transportation, the walking to the bus stop, those sort of small actions that become a normal part of your day, all support your health. And so it's critical to everything that we do.
No, that's real.